Hello everyone, this is Dr. Nasser, and in this smear I would like to tell you about acute promyelocytic leukemia, also known as APL. Based on FAB categorization, APL is identified as M3, and this is the low magnification. There is not much that you can see, perhaps leukocytosis, elevation in number of the white blood cells that are present on the film. There are some artifacts present. You should by now have a good idea what is real and what is an artifact. The smaller elements, we have to look at a higher magnification, which that is what I would like to do. And in here, I do see that there are some artifacts present. And as I go through the white blood cells, I do see these cells. When I look at this cell, if there were no cytoplasmic granulation present, these perhaps may be R rods. There is a dark cytoplasmic color, large granulation in the cytoplasm. If there were no granulation, this would appear completely like a blast. But this is one stage further in the maturation process, and it's a promyelocyte. I would like to look at more cells and see what other cells look like. As I go through the fields, I see that there is a large number of these cells present. Same characteristic. Nucleus is very large. The chromatin appears to be very diffused. There are cytoplasmic granulation, dark basophilia, and this is another promyelocyte. Promyelocytes come in two classes, hypergranular and hypogranular. And in this case, we are having a hypogranular APL. And again, the nucleus appears to be blast-like. Cytoplasm in this case is slightly more than a blast. However, there is large cytoplasmic granules in the cytoplasm of the cell. And this is another promyelocyte. Sometimes you would be able to see a characteristic of a promyelocyte known as an angel wing. Now, in here you have to use your imagination slightly, but the nucleus appears to have two lobes, two large lobes. That's whenever the cell falls on the slide in a manner that is right directly in front of your face in a right angle, then you would see these angel wings, this two large nuclei that appears like angel's wings. So you need to use your imagination. I do see polychromasia in this smear. This smear has some anisocytosis, and also the overall appearance appears to be microcytic cell as well. So these are the characteristic cell in the case of hypogranular APL. When I look further, I do see other cells with the same characteristics, and by this time I would be able to suspect the case is a case of acute promyelocytic leukemia. Hypogranular variation, and this is another angel wing that you can observe in the smear.